Hi, this is Ting O. I'm a physical therapist and I'm with FYZICAL Hazleton. What I'm here today to do is to demonstrate a kinesiology taping for knee pain and arthritis. The reason we're doing this is one of our clients actually wanted us to put one online on YouTube so that she can see and remember how to tape herself. So our client actually has some arthritis in her knee and she is doing her best to try and prevent having a total knee replacement done. She found that kinesiology taping was really helpful in managing her symptoms and her swelling. So one of the long-term managements that she's going to be doing moving forward is taping her knee whenever she needs to. So just remember, this particular kinesiology taping is designed for a specific person, so it may not fit everyone. If you want to kinesio tape your own knee, just understand that you may need specific taping methods for your individual problem itself. What we're going to do, I've already pre-cut the tape. What we're going to do, the first tape that I'm going to do is actually stabilize the kneecap, which is the patella. A lot of people actually have difficulties with their kneecap not being stabilized properly. So I cut a length that's about this big. What it'll do is go from the bottom to the top of my kneecap, just a little bit bigger by about an inch. And I'm going to find the outer bone aspect of my kneecap, which sits right here. You can feel it by a little indentation right there. So I'm going to start the tape in the middle and give it a little tear. And I'm going to cover the tape on my kneecap by around about 1/3. Right in the middle, yep. Now what this does is allows me to move the tape inwards. I'm putting the tape on about an 80% stretch. And it allows me to stabilize that kneecap, what we call medially or inwards, to help with the tracking of the kneecap. So the second taping we want to do is to facilitate or help a muscle work better on the inside of the quadricep. The muscle actually sits right here called the vastus medialis. For people, it's that little inside chunk muscle that you see. So the taping you want to do is with your knee bent as far as it'll go. And what we're going to do is find, again, the inside of the patella this time, on the kneecap. We want to start the tape there. And if we want to help the muscle work, we're going to put it on about 50 to 75% stretch. You'll know you stretched it enough when you can start seeing through the tape, and then layer it down along the length of that muscle. That's for the vastus medialis muscle. The next tape we want to try and help out with is the sartorius muscle, and the reason for that is it sits right on this little bump right here called the pes anserite insertion. There's a little bit of there's a bursa right there that can create tendinitis, and we found from our experience just doing a little bit of support for that muscle can help with that bursitis and that pain. So going a little bit below the knee now on the inside, we're going to start that tape right on a little divot right there, and our client will know what we're talking about. And we're going to put this one on about 50 to 75% stretch as well. The muscle winds to the inside of the knee and then back up towards your hip. And we're probably only going to go about the mid-thigh at this stage. The sartorius muscle actually connects right up into the hip. But we found that going about mid-thigh at this stage is pretty good. And the last tape we want to do is to help relax the outer quadricep muscle, or the vastus lateralis, as well as the iliotibial band. So this time, we're actually going to start the tape where the iliotibial band starts, which is around about here on the outside, just below the knee. And then we're going to come up over the outside of the knee and wind up on the outside of the thigh to around about, again, mid to upper third of the thigh. And that'll help facilitate or relax the vastus lateralis muscle. So I put that actually on a little bit too much of a stretch. To help relax the muscle, you want to only stretch it around about 25%, which is not much stretch at all. So that's the taping for our client, and with that taping, she's found that she can do a lot of her functions, reduce her pain, and hopefully prevent surgery for the near future.